Since we started the FroggyMouth project, so many people were telling us that it's great, all the stuff my father, Dr. Patrick Phillus, was able to do to show off his work. But at the end of the day, they are telling us we need studies made by independent people that have no conflict of interest with anything and that are not only showing clinical cases that they are treating, but that are showing statistical studies. That's exactly the story of how I was meeting and discovering Nataliia, that I don't know if you are seeing on the camera. I am so glad to have you here in France and in Paris, Nataliia. Thank you so much for coming directly from Ukraine. We know the time that it is for all the Ukrainian people, so we especially appreciate the effort of crossing the borders to come here to introduce you a little bit. You were a student, but now became a professor at the Ivano-Frankivsk University in Ukraine. I am so sorry for my bad pronunciation. French people, we have a bad accent, so especially with foreign names. And we discovered each other also thanks to an article that you were writing and a study that you made on the FroggyMouth, on more than 84 patients for the statistical one and even bigger for the whole study, which is the reason to share everything with you, why I decided to contact you to, first of all, congratulate you for your work, and also propose you to come in Paris to be able to present in front of you guys, in front of the FroggyMouth audience, all the work that you did. So here it is for the too long presentation of an already late webinar. Thank you so much for everybody that is there. And Nataliia, I will let you directly start. Good.
Dear participants of the webinar, today we will be discussing the basic mechanism of atypical swallowing in different ages groups, the principles of etiological and pathogenic treatment, and will review different clinical cases. You all know that I'm orthodontist from Ukraine. My country has been at war for 10 years, and for 3 years we are living under constant shelling and bomb attack on civilian population. There is constant alarm, and it's not so easy to live. But as my Italian friend Paula says, Ukrainians are always ready to rise up. You see in this slide, this year, Christmas in Kiev, it's not so easy to work, live in such situation. When I was a child, I used to look to these beautiful pictures of European cities during the war, and I couldn't even imagine and understand how people could preserve beauty and create beauty when the war is around. Here you see Paris, and here is Ivano-Frankivsk I live in. We still try to live, and the main word in it is live and try. We learn, work, and constantly help soldiers who wanted to fight in the war, and among them is my brother Petro. A lot of my friends, they are doctors, and in this photo you see my team. They help me not to put my hands down and still work. You know that orthodontists of Ukraine have united, and they are helping to their children who forced to change their place of residence, and they couldn't find the place where to finish their orthodontic treatment. Today, my dear colleagues all over the world, I have the honor on behalf of all orthodontists of Ukraine to thank you for giving this attending help for our patients and completing the orthodontic treatment. In the beginning of our webinar, I will ask you to swallow twice. You can record it, you can send in chat, and when you will finish this procedure, just put plus in chat, and I will continue. You're swallowing. I want to introduce you my favorite book in all oral habits. It is a book that was written in 18th century by George Cartin. It's called Shut Your Mouth and Save Your Life. He wrote that the most habit, again, the nature, is not, if not arrested, lead to disease. Remember it. And our task is to work with different oral habits. And functional oral habits is atypical swallowing we will talk today about. Have you finished with your swallowing? Can I continue? Put plus in chat. If you wish, you may send, and in the end of webinar, we will discuss your swallowing. It will be interesting, believe me. Let me continue. You know that all oral habits play an important role in development of maxillofacial anomalies and acquired deformation of facial skeleton. The basis of pathogenesis of facial-maxillar anomalies is chronic injury. It causes the deformation and disrupts the formation of facial skeleton according to function theory by Melvin Moss. Where often you think that injury is something like force, but where often this force is abnormal function of muscles. I want to show you a recent clinical case, and then we will continue according to theory. It's a 10-year-old boy. He is living under constant personal and social stress, which is related both with the situation in family and also work condition he lives in. We have oral habits in this case: atypical swallowing, tongue resting on the floor of the oral cavity, tongue thrusting, and also lip biting. Look how he swallows. I need to take a mouth. I want to show you his swallowing. Oh, I need a bag.
Okay.
Sorry, I will back to
What do you want to show?
swallowing. Okay, I want to show a lot of videos you will see in this webinar. That's why I mention and pay your attention on swallowing in different cases. You will see not only swallowing, but also oral breathing. Okay, look the other picture. I can't.
Since we are having a little... it's good?
It's good?
Perfect.
Perfect, okay. Look on his lip. You do see maceration on the lips. You see bacterial infected on his lower lip. Look, what do we see? We do see big protrusion of teeth in this case. Right now, pay your attention on lemon peel the patient have due swallowing. And right now, when I put on the FroggyMouth appliance, you see how this lemon peel is localized in the lower lip. Right now, look how he is thrusting. The tongue is pushed forward between the teeth. There are about 200 such thrusting per day. The same number of time a patient swallows, but this patient doesn't show signs of normal swallowing. No matter what technique you use, we won't achieve a result without a resting function. Look on my little patient. She lives in the fear, and even she is afraid to take auto wear. What she is doing, she is like breastfeeding all time due swallowing. Of course, her lower jaw is undeveloped. Of course, we will have formation of second class of occlusion. When I applied and fixed FroggyMouth appliance, observed of hypotonia of the chewing and mimetic muscle. This shows that Alexandra seeks a way to protect herself from stress. Look on these children. At this photo, you see children do swallowing. I prefer making video, but on photos you also see that patients use their lips and sacral muscles are contract. In second photo, we see lemon peel symptom in the chin area. It is primary swallowing. This primary swallowing is essential for breastfeeding. We have positive pressure from mammary gland and negative pressure from the oral cavity. We have contraction of lips and cheeks muscles. The muscles of these muscles support the tongue, and in such way the tongue pushes against the muscles and directs milk to oropharynx. In normal swallowing, the tongue muscle works and floor of the mouth and platysma works, but sacral muscles don't work in this case. Nor we will see the trigeminal and glossopharyngeal nerve will work. And this function, according to literature sources, start working in the age from 3 to 4. But when the patient live in terrible situation or some social stress, this time will be longer. What's atypical swallowing? And very often we have such questions. It is the same swallowing we have till the age of 4, but this occurs later. And what do we have? We have compensatory muscle contraction at rest. We have hyperfunction of chin and sacral muscle. We do have formation of open bite in the frontal area and with vestibular deviation of lower and upper jaw. We can have distal bite. Also, crossed bite can occur when it is related with the cheeks during swallowing. Today, one of the main factors considered in the development of atypical swallowing is stress, which prevents children of switching on action of facial nerve and the action of trigeminal and glossopharyngeal one. Candle says, everything we have in terms of habits and skills is the result of activity of nervous system. Stresses prevent child from against different swallowing pattern, and we do have this pattern till the age of 4. when the person is adult, this skill must be normalized by myofunctional therapy. And as Fellows Patrick emphasizes that the development of normal swallowing is the formation of skill that resembles scaling down the newly created slope. It seems to me everyone knows what is skiing on newly created slope, or maybe someone prefer snowboarding, for example, but it is the same. Newly created slope in our brain is neural connection, and we are to work and achieve automatically swallowing action. In recent years, we have gained the understanding of how long-term memory is supported and in cellular membranes of synaptic connection. O'Connor explained the mechanism of learning and memory, since most our knowledges and skills are not innate, and it's true, they are acquired, and we all can influence upon their development. The use of labial therapy helps the doctor to activate influence on primary swallowing pattern. In the long-term memory that our skills and memories are stored. To form a new skill, synaptic connected are important, which a person develops through life or certain periods of it. Synaptic plasticity is important for formation and normal swallowing pattern, and we are to work on it. When the patient have a typical swallowing, we need to reconstruct the swallowing and form a new synaptic connection. Then we will have normal swallowing. We all are familiar with Pamphlet mat, and you know I do have it in my working place and always show to my patient, because really they even don't imagine that it's so important for us. In this map you see the motor and sensory zones in cortex, cerebral cortex. Note that proximately of the centers to each other in stressful condition, they can change the synaptic connection. And you know, one of my patients, even after wearing on a FroggyMouth appliance, tried to swallow with eyes and started to blink. Due to this pathological condition, we will have some compensatory muscle contraction at rest, and as a result, adaptive changes in maxillofacial area. We will have changes of the bone formation according to Moore's theory of skeleton formation, and as the result, we will have a typical swallowing, hidden breathing, and malocclusion. We have conducted this study on the distribution of oral habits in 240 children in different age groups, 6 to 9, 9 to 12, 12 to 15, 15 to 17 years. The groups were randomized by the age and gender. It's very important for me. And as a result, indicate that over 90% of all participants had personal or functional oral habits, and among them, functional habits, especially atypical swallowing, was more than in 50% cases. You know, we do have very different devices for normalizing these atypical swallowing or other functional habits. However, every time I plan treatment for specific patient, I ask myself whether I use this method or this device for my own children. If you will do like this, you will not use a lot of devices, even myofunctional one. Phallus Patrick developed for us increasingly convenient, easy to use FroggyMouth myofunctional appliance for treating functional oral habits. I really use it in different cases, even in patients with hidden breathing, TMJ problems, with patients with night apnea where the etiological factor is our problem, dental one, and position of the tongue is distal. In all these cases, you have perfect device to use. Now, I want a little bit stop your attention on diagnostic of atypical swallowing, because very often you don't imagine how it works. First of all, I ask patient to swallow and then put a finger behind his vestibule or the oral cavity and ask him to swallow again. What do we have? We will have contraction of scapular muscle and you feel pressure on your little finger. It's important for you. And very often when my patient when I am a stressful factor for my patient, I ask parents to do this procedure at home, and only then you will have a perfect result on diagnostic. Look on the photo what's going on with the person, lips and chin due swallowing. We do see this lamellar pill syndrome in the chin area. In this video, you see the patient age 12 years. She is elder, but due swallowing, her chin and lips are working. After application of FroggyMouth appliance, you see how scapular muscle contracts. We do have the appliance in free size, and it's essential to carefully choose the size. Appliance should be smaller than the lips at rest. Of course, and it is the question of my students, doctors who I work with, that in some cases, size S, contact with the lips corner. Yeah, I do know it, but it is the smallest size. We are to understand for our patient, because they don't realize that appliance can be lips-based and correct condition in facial maxilla area. Therefore, your task is to emphasize this point to them. Over the time, FroggyMouth appliance change the color and it's normal. And please, you can use this one as diagnostic component to determine if your patient is conducting labial therapy or it just untrue and it is just living in the box. Treatment with FroggyMouth appliance have different stages, and it depends on the age of patient. When you work with children, it's enough 15 minutes per day, and every 5 weeks you need to have attending in your office. It's important for us not to give to patient the device and make treatment at home. You are to control and look, does your patient move from step to step or he stays in the one position? When you work with adults with mature elderly age, I prefer attending of FroggyMouth twice per day. Treatment at home must be not less than 1 month. Let's watch video. It's very good done. And you say have to wear FroggyMouth appliance. It must be in 90-degree angle between the head and neck, and it's very important. The procedure lasts only 15 minutes, but no breaks are allowed. If the patient drops the head, or you are to stop this procedure and make it again due 15 minutes with a normal position, and always appliance should be cleaned and stored in container. Look on the video, it's very good done. Then, don't forget, we do have stages. This attending in clinic is very important. For sure, not in all cases, it can be just 5 weeks. For sure, it can be 4, 6 weeks, but you are to do. This visit, what we do, we are to stimulate the nerve to work. We press the mirror against the tongue and ask the patient to force with the mirror and to fight with the mirror. My patient also liked this procedure. They said that their tongue become to work, and very often patient can swallow better after this procedure. The exercise must be done several times by you. We conduct also trigeminal nerve stimulation in the other way. We can put your finger and press in the chin area due swallowing. Also repeat this procedure a few times. And the last visit, very important for us, we are to wait and 5 weeks and then attending to doctor for aromatherapy. This stage is not clear for orthodontists and myofunctional therapeutists, but refresh this pamphlet map and you will understand why it's very important for us. The patient wears FroggyMouth appliance and you ask them to get the smell. I always cover the name of smell, of essential oil smell, because it's important. Just you will know what in my essential oil there is 1, 2, 3 written to be sure what one they are looking for. If the patient guesses correctly, it means you have succeeded. If you don't, please make the procedure at home 5 weeks and again try to do it. Let's observe the changes in swallowing of our patient Alexandra in the beginning of treatment. And look, 4 months, we observe different picture. For sure, it will be not 10 weeks because this case is complicated. Let's review the main criteria of your finishing of your treatment. Patient speak from 1 till 20 without using lips during swallowing, and during swallowing, sacral muscle doesn't work. It is not active. Look in this video. What you will see the patient in the beginning and in the end. Look, she's blinking. She can't even imagine how to swallow. You see? I do like this video. I have a lot of such. And really, when you start to work with myofunctional therapy, please make videos, not photos. 2-second video, put in patient card. It will be easier for you to understand where you do have differences. Look what do we have in this time, in 10 weeks. We have working of sublingual area. Victoria do have this myofunctional therapy at home and visited clinic every 5 weeks. And right now, look how she swallow. Her teeth closed. Her mouth is just, she need pronounce from 1 till 20 using only lips. Patient who doesn't have automatically function with working only sublingual area, he will never do this. That's why it is your successful result of treatment looking like. Look another case. The patient with FroggyMouth appliance before treatment and also after starting the treatment. I want to show you very specific case. It's very specific patient. Look at the promote placement of the tongue in the frontal area, you see? How where the patient worked, he activated the tongue in the act of swallowing and pushed in the frontal of the teeth. She has open bite. And right now, we see how swallowing can be looking after working with FroggyMouth appliance. We ensure the formation of new synaptic connection, you see? Sublingual area works. Beautiful type of swallowing we have done. Oh, it's my favorite one. Once I saw such device online. It's a Hyrex with rolls for muscle stimulation. Perhaps this device someone of you use. Believe. It's very terrible device for patient. We can find the other way of correction more easier. I believe it's always important to think about how our patient will live with this device. That's why I think on this point. Look, I suggested the other way of correction. For sure, when we do need to have a Hyrex in the age elder of 12 years, I prefer with tucks on palate. And all time, I need FroggyMouth appliance in more than 90% of all orthodontic cases I do have. The appliance Platinum 1 Hyrex, you see this Hyrex always is modeling Unix Onyx Staff software, because for me it's very important where these tags should be fixed. It's looking like this. I need to be sure all the time where I fix these tags. Another case. It's Sofia. She is 6 years old. She had a problem with the eruption of permanent group of teeth in the frontal area. But you see, she had a number of oral habits. Among them is oral breathing, atypical swallowing, and cheek sucking. You know, pay your attention also in cheek sucking, because it's very popular oral habit today. It's important for us to increase the volume of upper jaw in transversal place and lower airways and teeth, and will have space to grow. In such way, we also need to teach the tongue to find its normal position on palate, because this muscle can naturally form the palate and naturally form the maxilla, not only ear formation of maxilla. Also, we need to work with tongue position, because tongue form the maxilla in transversal position when it only finds this place on palate. This is also an interesting case. It's 8-year-old patient. This situation with lips in the beginning of our treatment, I hate really. I don't like, it's very easy to say, I hate remote treatment, but in the beginning of war, they moved to Germany, and I need to do something with this patient. I sent them FroggyMouth appliance, and his mom started this remote treatment with our orthodontist in the clinic in online working, and we look the dynamics during remote treatment. You see later we don't have bacterial infection on the oral cavity and oral mucosa, and lips is clear, and we have the good formation of the upper jaw. Clinic case, another one is patient 11 years old, acquired deformity on the lower micrognathia class 2, oral habits postural one, and atypical swallowing before and our treatment, you see. In this case, there was brackets and myofunctional therapy with FroggyMouth appliance. Pay your attention on comprehensive analysis of computer-aided 3D reconstruction of the skulls. You see in the frontal area where we have injury of the scapular muscle, we do have a perfect growth of this lower jaw in the frontal area. Please remember, muscle also are injury. It's chronic trauma. Chronic trauma, we will not have the growth of the lower jaw. Another case is Sophia. It's a very nice one. She sucks her cheeks. She have hidden breathing and atypical swallowing. A lot of oral habits in one patient. That's why you are to examine your patient very careful to find all of them. We do have upper micrognathia. The plan of treatment was Hyrex with supported on 2 tucks and bracket system. Also, she have FroggyMouth appliance in the beginning. What do we have? In 10 days, spreading of upper jaw. She continue work with FroggyMouth appliance and transversal dimension of the maxilla before treatment and dynamics. Oh, it's victim of incorrect orthodontic treatment. I always says to my students, no, don't do it. First of all, find etiological reason. Make a perfect examination of all habits, and only then plan the treatment. In class 3, and position on the bottom of the oral cavity, the patient had extraction of 1-4, 2-4, 3-4, and 4-4 teeth. And in retreatment was included Hyrex, and there was FroggyMouth. It was the first one. and bracket system. Look how she is looking after 4-month treatment. Also, you see transversal dimension of maxilla before and after it. One more case. It's 15 years old patient before treatment and after, before treatment and after it. In the beginning, we have FroggyMouth appliance and brackets. Look on skull reconstruction. Also, you do see stimulation of growth in the frontal area. Always remember that patients with TMJ disorder, they also have problems with muscles, and we are to correct this situation. Very often, I recommend it to you starting FroggyMouth treatment after splint therapy, because it will be hard for you to combine it in one step. You see how she is swallow? Her swallowing, she even don't know what to do, how to swallow. Very often you will see such panic. Few cases about autosurgery. I really don't prepare patient to surgery until the position of tongue is uncorrected. It's true, and surgeons whom I work with know it, that first of all, I need to make a normal position of tongue. It's a patient, it's Tanya, she undergoes borderline future surgery. In meantime, FroggyMouth appliance has been starting working. My functional correction before surgery allows easy and systemic treatment and systemic teaching of the tongue to stay on palate and create this important vacuum during swallowing. And you are to explain to surgeons. Very often they don't understand this point, but it is very important for us. Also, the steps of borderline and our result after it. Not in all cases when we do have third class of occlusion, we do need surgery. I always work with other unremovable devices for distalization, for example, carrier motion appliance with FroggyMouth, because when you do see the case third class, for sure the tongue is in the bottom of the oral cavity. You are to correct it, and it's important for you because you will make the time of this treatment shorter. You will normalize the function, and you see that my correction shorted this time of treatment, and the harmony of face depends not only in occlusion but also posture, muscles, and they are so, and TMJ position are very important for us. Oh, a nice case. I want to show you, it's a patient, she is adult, she is 42 years old. She came with such clinical picture. Look on X-ray. On X-ray, you see distal position of tongue, and very often, due even examination of some teeth, you can find this abnormal distal position of the tongue, and you can be the first doctor who will correct this position, and your patient will have better life. And you know, one of my patients have nightmare, and after FroggyMouth for 2 weeks, she had better result, and she told me, you know, I sleep. I don't have problems. I don't have snoring, but not in all cases, but nightmares are going in some other way. Look in this patient. Look on her vestibule. never start active orthodontic treatment when you do have shallow vestibule of the oral cavity. This generalized periodontitis in this case is the reason of uncorrected vestibule in the age of 12. We correct it, as usually wait 3 months, and only then I start orthodontic treatment. In the beginning, you had to see open bite, and right now we have finished our treatment. For sure, there will be orthopedics will work and therapeutics, and they will create a nice smile for this patient. But FroggyMouth remains a loyal friend of our Svetlana, and you are to explain for such heart patient that it is not only for treatment time. You are to use it long term. You will not have problems with the neck situation, with platysma. The patient will look younger due usage this FroggyMouth appliance. Last case. This patient come to the clinic already with brackets installed. Unfortunately, her orthodontist passed away. We do have such situation, and the primary diagnostic was class 2, oral habits, pushing the tongue against the front, and positional habits resting on the left hand. In the left side, treatment was completed with orthodontic bite and normal swallowing. Only successful treatment can be when we have a perfect function. Right now, let's take a look in at some scientific results. It's a Shankly diagram for patient. It's clearly showed that 240 persons started their treatment, and in the beginning they all were in stage 0. And in 10 weeks of starting treatment, they have better result. But not all children have transformation and automatically perfect result of swallowing. In children of 6 to 9, transmission of this treatment is more easier, and you do see it in this blue color in first group in the end. But for children that are age 15, 16, 17 years, it's longer. That's why you are to continue this treatment. The same you do see in these results. Have a look on this picture. It's results of our myofunctional rehabilitation with FroggyMouth in the other groups. In the beginning, they all had atypical swallowing, but due to the time, in 5 weeks, we have better result. We have transmission of this swallowing pattern, and you do see how it changed. More than 1/3 of patients in every group have changed pattern of swallowing. Then you see the same group of patients in the beginning and in the end of our treatment, and we do have a perfect rehabilitation of treatment. Our results are the same we do have with other doctor study. It's Dr. Comet study. This study showed that automatically result will comes in the age of 10, but it can be in stage 1 or in stage 2. Not in all cases it will be in stage 2. We do have similar results in such groups of patients. Often, I'm told that it's impossible. 15 minutes per day is too much. But these are still from this video, and it's just screens of different video. One of my patient mother does every day, and she wanna know how this motor reaction of swallowing in her daughter will be present. And you know it's possible. And the key of the desire and understanding what is happens of the body when systematically perform myofunction, you will have a new pattern of swallowing in this case. We do need to summarize and to understand that not all cases we are to start with myofunctional therapy, and not in all cases we use it like the first step. That's why the task is to find the reason. Etiopathogenetic treatment is the best treatment you can choose for your patient, and step of this treatment should be done according to type of problem. For example, when we do have only atypical swallowing, start from myofunctional treatment. When your patient do have problem with breathing or hidden breathing or oral breathing, it doesn't matter, you are to work in team with otolaryngologist, and he will be the first doctor in this patient treatment. When the patient have postural habits combined with functional one, you are to explain this problem to your patient and his parents, and only teamwork will give a successful result. You know, and I always says that Fitzpatrick phrase is important to know that chewing, swallowing, breathing, and articulation are interrelated and affect each other. Dysfunction of any of these components leads to changing in maxillofacial area, and your task is to explain and emphasize it to your patient. I know that is phrase not yours, but it is associated only with you. You are to explain that the tongue is the princess that has its own place on palate. And all time, even in Ukrainian congresses, I don't translate it because the tongue is a girl, but in Ukrainian one is male. That's why I don't translate. Let's consume. Atypical swallowing is one of the most common oral habits, and results of my scientific work showed that in 15% of cases we have this swallowing, and it occurs equally across different age of person, and even you can have this atypical swallowing. Comprehensive treatment with FroggyMouth appliance activate the growth of cellular structures in a rest affected by traumatic factors and restores the functions of swallowing, tongue, position, and hidden breathing. And also I do use it in sleep apnea when the reason is our dentofacial problem and distal position of tongue. Thank you, my dear colleagues, for attention. Thanks for supporting Ukraine. If you do have any questions, I will be happy to answer on all of them. But let's right now turn on your videos when you were swallowing. How many persons have atypical swallowing? But truly speaking.
Thank you so much, Nataliia, for this absolutely wonderful lecture. I have to say that I was your first spectator being next to you during the lecture. You can directly all participate in the chat right now, sharing honestly what was your tongue posture and the question that Nataliia asked you, because as we know, atypical swallowing is so much more common than we think, that even among the dentists, the orthodontists, the therapists, surprisingly, many people are still dysfunctional, also because it's never easy to treat the patients. And that is leading me to one of the first questions that I want to ask you and that I was seeing on the chat. And you were speaking about the little exercise on counting from 1 to 20 to be able to assess something. There was 2 questions about it. If you could quickly re-explain what are you exactly looking at and if it is telling you to stop the FroggyMouth treatment or not.
Okay. I don't know who has asked this question. Try to spell from 1 till 20. We are to use our articulation with lips, and we always open the mouth, yeah? But in this case, we are with the closed mouth, but only lips work. When the patient do have atypical swallowing, he needs to swallow, do this term, due swallowing from 1 till 20, and you will see it. That's why it's the easiest way to know, do we have a normal swallowing or not? Try to spell. Everyone can. I can.
Me, I can try.
I can try to talk.
1, 2,
1, 2, 3,
4, 5, 6, 7,
and
8,
you don't
9.
need to swallow due this term.
No, I keep
But the patient with atypical swallowing, he can't make this one. He needs to swallow, and then he will continue.
Exactly.
That's why it's very important for us to emphasize this first stage of FroggyMouth treatment. You know, even when the patient have automatically function, I ask my patient to take on FroggyMouth appliance even after period of formation of our normal swallowing pattern. That's why use the FroggyMouth 1 or twice a week after final normalization of function.
That is making me thinking also of another question that I was seeing on the chat. You spoke at some point of time about the motion carrier. Could you please, first of all, quickly explain what is the motion carrier for the ones in the audience that do not know this device, and also tell us how were you using the FroggyMouth plus the motion carrier together?
You know, it doesn't matter what unremovable appliance you will use. You can use it with aligners, you can use it when you do have relapses, you can use it with brackets. Function is very important for us. When we do have carrier motion appliance, it's device for distalizing. We do have 2 of them. We have for class 2 and class 3. In this case, I was showing to you, you see class 3 for distalization, the lower jaw teeth. And for sure, the patient, when has such patient do have formation and fixation of tongue in the bottom of oral cavity, and our task is stabilize the position of tongue in the palate, and only then this term of carrier motion will be shorter. and very often it is from 1 till 3 months shorter with the in general treatment.
Many people in the chat asked for some details about your studies, and they were really impressed also about the size of the sample of patients that you could be treating with. Me, I was surprised of one point also when I was seeing the results. Of course, I was appreciating the results, but I also especially appreciated the fact that you were having very similar results no matter the age group. And many people are often telling you, yeah, but we can only do the myofunctional therapy on young patients.
Yeah.
Maybe some of you think that we can only do the myofunctional therapy on very young patients. What would you have to say about that based also on the results you get?
Mm-hmm. Okay, thanks for this question. When we are talking about results, this work was done, it's my scientific one, it was done in the patient in this term of age, but I do have the other groups of patients. I also work with the adults one, and very often it's important for us to emphasize that it's very important for our neck, it's important for our platysma, it's very important the position of tongue. For women, it's so important because we want to look younger. And cosmetologists can't work in this area because it is very tiny one. Only surgeons or myofunctional treatment. And you know the simplest way of myofunctional treatment is FroggyMouth, because you took it on and 15 minutes you are sitting with your child, and very often I supposed to in one home, one for mom, one for child, and they both make stimulation, mom for stimulation of platysma, and young person for normal swallowing or hidden breathing or any other, or lip sucking. But you do see that we have the same age of children with other researchers, and it doesn't matter what country they do live in, but the term of normalization are the similar. But my dear colleagues, you are to remember that one person do live in some stressful condition. It doesn't matter just war or fear of war. It's quarantine, online studying, condition in family, condition in any team. It's also some stress factors. We know that it's individual and social stress, and no matter you work with, you need to stabilize the function, and atypical swallowing is the first one that will appear and return you in the safest time you have. And you need to know, you need to remember that the safest time for you is your early childhood, when you need this swallowing for breastfeeding. And right now, it just it shows that you are in stress and you are to normalize this function.
Young habits are always the most important one.
Yeah,
there is one point that people also highlighted, and I think is very interesting. We can observe, of course, such a big gap also on the results between 5 weeks, because after 5 weeks, we are seeing that you are not having yet half of the positive results, which is such a big gap in comparison of the results after 10 weeks, where you are having only 17, and 19% of failure. Have you changed something between week 5 and week 10? And why was it becoming that good that quickly?
Let's refresh about newly slope.
About?
About newly slope. It did the same. We started our work. Have you skin on newly slope? It's hot, yeah?
Yeah.
Yeah, for me it's also so hot. But when I started to skin it, it's more easily later. The same with normalization of function. We need to restore new synaptic connection in our brain. Our cortex needs to work in the other way. In the beginning, believe me, a lot of patients continue blinking. But later, their results are better. Make these videos, and it will be very interesting for you, and it will be very interesting for your patient. It's really nice to see these changes. And for sure, not in all cases, in 10 weeks, we will have perfect result. That's why it was just the term of scientific.
Of course, it takes a little bit longer on some ones.
For sure.
What's
as usually 4 months.
Usually 4 months?
It's usually 4 months, but in when the patient is in the term of 6 till 9, it's faster.
You already answered the question even before I asked it, because that was exactly the point of my next question. There is one question from our dear friend Ilya from Romania that is, first of all, congratulating you from the Romanian neighbors and asking you if you are usually placing the FroggyMouth in the first meeting, or if you are treating the functional for a period of time before the ortho, or sometimes start with both at the same time.
Okay, thanks, Ilya, for your question. First of all, you ought to understand different. I don't buy one FroggyMouth appliance for my clinic. And if you will look on my stories in Instagram or clinic stories, you see a big set of different FroggyMouth appliances. For sure, I used 5 or 6 L size, as usually it is S or M one. But I need to have them both in my clinic. When it is a small child, very often we do need just FroggyMouth appliance, and we don't take a time. We start our treatment from the first visit. I teach the person, I explain for the mom, I record a video in clinic for my patient. This video, Guillaume, yours one, and it's very nice to explain how to work with child at home. In a case when the patient do have, for example, TMJ disorders, I don't give. I do see this problem. I write in medical card that I do need to correct it, but I don't do it in the beginning. First of all, gnatologists may explain therapy, work with patient for a few months, and then when he sent patient to me for fixing brackets in that period, I give the patient FroggyMouth appliance. When the patient are preparing for surgery, for sure, I will be the first doctor. And very often, I'm troubling when the surgeon say, okay, in 10 weeks, there will be surgical operation. I always says, let me wait, let me automate this function, because after operation, me is the first doctor who will meet this patient after anesthesia. And the first question I will ask him to do, I will ask to put the tongue to palate. When the function will be atomized, it will be possible to do. In the other way, it's impossible. And we will have relapses after operation. That's why let's do it step by step. 2 or 3 weeks, it is not a time for such not easy autosurgery process. And also with unremovable Hyrex or MAP, it doesn't matter what one we will use. For sure, I started from the first day. Why not?
There is some questions that I directly take to not put us also or to late many questions about the sizes of the FroggyMouth. If you have any concerns about the size of the FroggyMouth, you can type online how to choose the size of my FroggyMouth, and you will get a dedicated page to explain you a little bit about that. Maybe that there's something.
We are less of time, or I can explain once more.
Yeah, go for it.
Yeah.
Yeah.
Okay. FroggyMouth appliance must be smaller than the patient lips at rest. I have in clinic several metal rulers that we do sterilize it, and we measure the patient lips at rest. And then I need to choose smaller FroggyMouth appliance. For sure, in some cases, it's impossible because the smaller side is S, but
that's exactly one of the questions that was on the chat. When you're having a very young patient that you want to treat with the FroggyMouth,
I do it.
You do it?
Yes, for sure. I do have the perfect result.
That leads me to a question for you, the chat, and also for you, Nataliia. Should we, as FroggyMouth, develop one smaller size?
Yes, excess.
Excess. Okay, so now we are making a deal right now in live. In front of you, you are our...
In orange box. It will be very nice for my clinic.
I have to say that I was already thinking about the green box.
Color, green?
Yeah.
Maybe
I love the green box. We don't have the green box yet.
Green?
To just fit my shirts.
Okay, let it be green, like FroggyMouth. It's also the favorite color of my daughter.
So that's perfect.
Yeah, really, it would be perfect when the size will be smaller.
A few more questions also. If you have a lot of questions, many of them can be found once again online on our website, also including about the protocols, because when you are clicking on the treatment page on our website, you will see a beta test of a new online guide to help you a little bit. It's not yet the actual version, the final version, but you have a beta testing of it, and we'd be glad if you want to use it and send us all your feedbacks about it. That leads me to also another question that I think was coming often on the chat. Many people were asking if you are adding sometimes some active exercises, and at which point, because to directly clarify, some of you ask if it is replacing myofunctional therapy. It's not at all something that is competing, it's something that is supporting. When both can be used together, it's always wonderful. Unfortunately, it's not always possible. So that leads me to the question, the last question, you as an orthodontist, are you sometimes adding some active exercises, and in which circumstances?
When we are talking about different appliances we combine FroggyMouth with, for sure you can do it. It must be function, and occlusion must be connected. And only then, when you will work together, you will normalize the function, you will have a better occlusion. You even in cases when you do have, for example, relapses, I even don't remove unremovable retainers when they are soft one, for example, only aligners from the upper jaw, and give to the patient FroggyMouth appliance in few weeks, and you will have more better result. Not in few weeks, but the time of treatment. I do have some of relapses in my patient who were finishing their treatment abroad, and doctors sent me perfect result. But believe me, even when the person is not in his native country, but his native country is the war right now, he is in stress. And really, I sent to my patient a lot of FroggyMouth I bought and sent abroad, and I do have such treatment, it's true. We are to work with relapses. You know, I all time say to my students that doctor don't have relapses that don't work.
That's very right.
When you just talk and don't work, you are just lecture. But when you work and communicate, combine your practical work with science, and it's more easily. And you for sure will have relapses, all have relapses, where often I even need to when I do have some consulting with other therapeutics, for example, they do have changing of position of frontal group of T after perfect restoration. For sure, they take FroggyMouth appliance and they have a normalization of frontal area teeth formation. That's why it's possible. Everything is possible when you work with function. And it doesn't matter what age you work with.
That leads us maybe to the best conclusion we could be having about that, which is that we are doing science, medicine. Every patient is absolutely unique, so there is no cooking recipe, there is no general rules. Everything that we are telling you and sharing with you in all the FroggyMouth scientific contents are always the personal experience of some practitioners that are glad to come, like Nataliia, to share their experience. Thank you so much for that. You can find so many different ways of using the FroggyMouth, and what we try to do at the FroggyMouth Incorporation is not giving you recipes, is teaching you the vision that we have, the vision of Dr. Patrick Philus, to give you the opportunity to make your own choice and take your own decision in front of every patient. That's the philosophy that we try to share, and probably my conclusion word. Thank you so much, Nataliia, for coming to Paris to help us to share your experience. It was such a beautiful surprise when I was reading your article, and an even bigger one when I've seen you arriving in Paris. Thank you so much. I leave you the word of the end.
Thank you, Guillaume. Thank you. I need to thank Phallus Patrick, because this is one of the perfect devices we really have in our myofunctional therapy. Thanks you, dear participants of this webinar. If you would have any questions, I will try to answer you online. It's not a problem. I do understand that we are less of time. Thanks for being with us. Thanks this spring weather and perfect Paris in February like it is in spring. I really was afraid when Guillaume told you will come in February. I thought, oh my God, it's winter. But really, flowers are all everywhere. And even today I saw the blooming rose. That's why life is everywhere. Thanks for being with us. Thanks for working in myofunctional therapy. Even if you didn't use FroggyMouth yet, try to buy this device in your clinic and start practice with it. You will emphasize that it's truly perfect device, and you will have a perfect result with your clinical cases and less of relapses in the end. Thanks. What about your swallowing?
We're not having the, I don't know. We will be checking and we'll be sharing with you
please share
all
with
the results.
I think that half of percent of all cases we have atypical swallowing. And first of all, very often in congresses in Ukraine, in the end of meeting, person check the swallowing of each other and buy FroggyMouth appliance for themselves. That's why it's a very interesting one. No one knows what stress factor can cause on our body. That's why think on it. Have a nice evening. Have a nice mood. Goodbye, my dear friends. See you soon. Bye.
Thank you so much. Thank you once again, Nataliia. And us, we are seeing each other again in 2 months exactly. As you know, we are organizing every 2 months those webinars. So you can already register on the FroggyMouth website or send us some messages. Maybe that the registration link is not live yet, but already send us some email to register. permanently on a list where every 2 months we directly going to send you the link of the webinars. Every 2 months, a new practitioner share his clinical experiment. Thank you everybody and see you in 2 months.